20 years ago, Dr. Judy Griffin, a nutritional chemist, was diagnosed with Crohn's disease, a potentially fatal illness. Trained in science, she investigated the various traditional avenues available to her. But in the end, Dr. Griffin chose a very non-traditional way to heal herself.
I had Crohn's disease, which is a life-threatening, serious type of disease that affects, for me, it affected the small intestine, and it's an inflammation, it's an autoimmune disease. And I was in pain every day from the inflammation. And I'd be rolled up in a ball in pain, and my options were to take heavy dose steroids and immune-suppressing drugs, which I didn't want to take. So I was praying for guidance.
At this critical point in her life, Dr. Griffin went into her garden, the place she loved most. It was in this peaceful setting that she received the guidance that would change her life forever.
And the message I started getting very quickly was to work with flowers. And I thought maybe I wasn't hearing right. I really wanted to get out of pain. And when you're in a lot of pain, nothing else matters except getting out of pain. Eventually, very shortly, I got the idea that I was supposed to make flower essences, and I just started working with the ones that I had around in my yard, and I would get out of pain.
According to Dr. Griffin, her inner guidance led her to discover the healing quality of flower essences. Following the information given to her by the flowers, she formulated her first essence and began regular treatments. Miraculously, her Crohn's disease went into remission and remains so today.
I had twins, and they were born with immune problems. They were actually immune deficiencies. They didn't call it that 25 years ago. But they were so-called allergic to everything. Their skin bled all the time. They'd have 105 fevers. One would go into anaphylactic shock. One would have asthma. And so I started working with essences with them. And at first everybody thought I was really stupid and crazy. But within 6 weeks, people were telling me that they could tell a big difference. Within a year and a half to 2 years, there was, they were doing normal things all the time. But most important, they were alive. They were well. My youngest son, he was born 4 years after the twins. And when he was 2 years old, he was actually tested and diagnosed as having a 50% hearing loss. And this was neuronal damage. He was not supposed to be able to get this back. I really couldn't quite accept that. It didn't feel right, and I felt like I could find an essence that would help him, and lavender is what I was guided to. After 3 weeks of using the essence, I took Jason back to the doctor and had him retested again, and his hearing tested perfect. I asked the doctors about the neurological damage, and they had nothing to say. I told them what I was doing with the essence, and they told me to go home and keep doing it. It was obviously working.
Using her background in chemistry, she created a unique way of bringing the message of the flowers to the world.
The more open they are, the more creative energy that they have expressing, and the more of the lipoic acid and the different hormones that I express and extract from these flowers.
While there are many different ways to make flower essences, Dr. Griffin's method uses only pure organic ingredients, combined with her ability to attune to the flowers themselves. According to Dr. Griffin, the oil's aroma goes directly to our brain, producing hormonal and neurochemical responses that flow through our bloodstream. This often results in an enhancement to our immune system, as well as helping to reduce stress in our body. Flower essences can be used anywhere on your skin, but to be most effective, Dr. Griffin recommends applying them to the pulse points, such as the wrists, the temples, and the throat. Another location is an acupuncture point used in Oriental medicine, known as Shanwen. Located in the right ear, just above the ear opening, it is where 5 cranial nerves converge into a ganglia. This point optimizes the effect of the essences throughout the nervous system. Through an ongoing dialogue with the flowers, Dr. Griffin continued to find new ways to use the essences, and over time, developed more than 100 products from flowers she grew in her garden. These products addressed a wide range of health issues, from memory enhancement, building self-esteem, and weight loss, to a complementary approach for the management of pain.
One patient I can think of came to me, and she already was in stage 3 breast cancer, very high infiltration in the ducts.
First thing, she wanted me to have a biopsy because she says, I want to know what we're dealing with here, Diane. And since I knew she was already working with medical doctors and nurses, I felt comfortable because Judy made me feel comfortable. Right before I went into surgery, they came and they got me and they said, okay, you're going to have to go an hour early. And I went, oh no, and I panicked. And so I grabbed the flower essence and I put them on and went down. And the anesthetist said to my husband that I was so easy to work with because I was so calm.
When she went into the hospital, she used Bouquet of Harmony, which is a combination, a trilogy of essences that I use. And what was remarkable about that is she went, after mastectomy, she didn't need pain medication. And anybody that's had surgery before, that's quite remarkable because they offer you morphine. And she used her essences instead.
And when I saw my plastic surgeon, I had my surgery on Wednesday, and the following Wednesday I went to see him at his office. And he's asked me how I was doing with pain, and I said, I have 0. And I mean, I wasn't being a martyr. I was 0. There was no pain at all, and all I was using was Judy's flower essence.
Another remarkable thing that happened with this patient is she didn't lose her hair during chemotherapy or her eyebrows.
Okay, this is not my hair now. This is a wig. And underneath, though, even though I lost half my thickness, to have some hair, it's great. When you go slick bald, I mean, anyone that's been through treatment, particularly a woman, will tell you that's the #1 thing that they dread and they have the hardest time with is losing their hair. So I called Judy and I said, do you have anything that I can take or use that would help my hair, keep it from falling out? And so she says, I have some shampoo, and it's her lemon thyme shampoo that's for a damaged hair. So I got it and I started using it, and within 2 days, my scalp stopped hurting. And usually with Taxotere, you lose your eyebrows and your hair. I mean, you just lose everything. I've never lost any of my eyebrows, and I wash them with her shampoo. I mean, I'll tell you, but I do. And my oncologist, when I saw him this last time, he was just amazed again that my hair, that I had my eyebrows, because he said it usually wipes out everything. He said that was really rare.
The success of essence therapy to relieve pain in some of Dr. Griffin's cancer patients was encouraging. But behind it all was the question, would her research with flower essences ever be accepted in the high-tech world of CAT scans, magnetic resonance imaging, and radiation therapy? The answer came when a newspaper article featuring her work led to an invitation to Baylor University Medical Center in Dallas, Texas. Baylor is one of the leaders of integrative medicine, which combines the best that medical science has to offer with complementary approaches. Their philosophy reflects a new trend in medicine, the blend of spiritual and emotional nurturing with traditional physical care.